world of cerebrovascular disease, I think we're embracing here the concepts of how we can use telemedicine to extend the care and reach that we have for patients. Not only do we want to have novel approaches to patient encounters, where we don't want to just think about ourselves in the telemedicine realm as limited to your emergency department telestroke evaluation, but we want to think about how we can engage patients by distance who can't necessarily travel easily for telemedicine encounters, as long as they fit within the paradigm of what should be considered within the licensure of the physician. So I'm licensed in a number of states. I can do new patient evaluations now through a telemedicine portal, where I can evaluate patients, I can discuss potential treatment strategies, and we can talk about how we might be able to provide additional aftercare for the patients. I routinely do follow-up visits in cities, states where I am licensed, where I can do and conduct continued clinical care for those patients using the telemedicine strategies. And this has allowed us to reach and help a much larger population of patients. I think some of the huge challenges in telemedicine right now is this is a very viable strategy. I mean, the more practice you get at it, the more examination you learn you can do through a televideo encounter. But it really comes down to the system has to support this innovation. And that system has to be a much improved medical licensure and at the federal level. I mean, this idea that we have to go through so many hoops to achieve licensure in specific states, and that if you're not licensed in a state, you're so restricted about the information you can share. So if you're not licensed in a state, basically you can provide educational information, but not direct patient treatment recommendations. We really need to evolve past this. This is the way we can deliver care more effectively to more patients. This is potentially affecting access to care issues in a way that I think that wasn't conceived of 20 years ago. The access to care issue is, as we talked about before, just so critically important to maintenance not only of good health, reduction of stroke risk, both primary and secondary prevention. So, national medical licensure. There are these multi-state compacts now for medical licensure. This has not gone far enough. We need to take the jump at the federal level to being able to have one single licensure system for all states. And until that happens, access to care will continue to struggle while the telemedicine field continues to drive forward the capability to be able to do it. So I think we are doing encounters in so many different environments. I do telestroke, I do new patient evaluations, I do follow-up evaluations. I think we need to continue to push the envelope on this issue because that's what's right for patients. I think we have the backing of organizations. What I don't think is that has been easily able to overcome the states' rights versus federal rights to control of medical licensure. And there's still, states want the right to control that. The federal government needs the capability to do it in order to improve access to care. And this idea that I have to create multiple different applications and pay different fees in every state just to be able to do this is just putting impediments to patient access to care. The telehealth revolution is here. The systems to support it aren't.